All right, here with Dr. Amer Zeidan from Yale University, Yale Cancer Center. First annual HemOnc Pulse podcast live in Chicago. Thank you for coming. So you're going to be, you're a panelist on the unanswered question session on MDS, myelodysplasia. Briefly, what are these top 3-4 questions in MDS that you feel are burning questions for the research community in that field?
Yeah, absolutely. Thank you so much first for the invitation, Chadi. This is such an amazing meeting and excellent agenda. I have to say there are more and more unanswered questions that keep popping up across all malignant hematology, but in particular in MDS. So MDS, especially in the lower risk disease, has seen very important developments over the last 2 years in particular. And we moved from not having really any important options to treat patients to having multiple drugs. Now, in addition to erythropoiesis-stimulating agents and lenalidomide, we have seen the approval of luspatercept, initially second line and now frontline. And of course, we have impending approval of imetelstat. So I think between all of these agents, many questions are coming up around right use in the frontline setting, which agent should be used, especially in RS negative patients, about the sequencing of therapies, and eventually about the combination of therapies. So I think lower risk MDS is seeing a lot of debate, which is, I think, very helpful. In high risk MDS, we have not seen the same kind of progress so far. We are still waiting for a combination that will be better than azacitidine monotherapy. Multiple trials have unfortunately been negative, phase 3 trials. Some of those will be presented in EHA next month in June. But we still are waiting on Verona, which has a combination with venetoclax, which many of us are hopeful that is going to be positive.
What's the Verona one?
So Verona is a randomized phase 3 trial of azacitidine with venetoclax versus azacitidine with placebo.
And that's in high risk.
Correct, that's higher risk MDS. So the standard of care continues to be HMA monotherapy. And of course, there are a number of questions about classification and what is the best tool for prognosis, but I think these are are not as interesting as the questions related to the therapeutics.
Well, it's going to be a great discussion, and looking forward to having you on board. Thank you so much for coming.
Thank you so much for inviting me.